Can you, okay, hold on one second. Let me just, okay. All right, good. Okay. How's that? Did that go through? Did that work?
Yeah, it's better.
Okay, great. Okay.
So, Dr. Alexandra,
All
you have
right.
the floor.
Good. Okay, great. I want to get a how's actually what we got here. Um, started. We have a lot of noise in the background. Can you guys hear me okay? Or maybe mute the microphone. That would work. Okay, that's better. So I know that most of you are medical students, is that correct? So tell me a little bit about how the journey. Uh-huh. I can't really hear you guys. Can you hear me now?
Yes, we can hear you.
Hello, Dr. Alexandra, we can't hear you.
Can you hear me now?
Yes, we
Can you
can receive you 5 on 5.
Okay, perfect. Before we get started, I want to find out a little bit about what the process looks like in Africa to become a cardiothoracic surgeon. Is it medical school to residency to fellowship training, or is it straight from medical school, like, and it's just an extended training? How does it work? Because I know it's different in different countries.
Okay, I'm going to start with the example from Cameroon, which is a bit
Uh-huh.
different from others. In Cameroon, we don't have a cardiothoracic surgery training program. So
Okay.
directly after medical school, that is, you enter a medical school through a competitive entrance exam, and you do 7 years in medical school. After your 7 years, you can write another entrance exam to go into specialty. Generally, we have specialty in general surgery and other subspecialty, but cardiothoracic surgery is not available in the country. So most cardiothoracic surgeons that are based in the country are trained out of the country. So some are trained in South Africa, some in the US, some in the UK, and some in India and other countries around.
Okay. Okay. And then I see a comment in Senegal that they do both as well. So it sounds like it varies across the continent to like exactly what the training process is. It's in the US, what we do is there's generally 4 years of medical school, and then we have residency. There's different pathways to get to cardiothoracic surgery. But generally speaking, most people do 5 years of general surgery residency and then 2 to 3 years of fellowship training. There's also these programs that are like 4 and 3 programs. And then there's also something called an integrated program, an I-6 program, where essentially it just combines all the training in 6 years. And I think it's important because I want to talk about picking a mentor within cardiothoracic surgery. Because I think that who your mentor is or who your mentors are gonna compile like a significant amount of your not only your view of the field, but how you progress and the decisions that you're making along the way. So, when you guys are, I just want to find out a little bit more information. When you guys are training and you guys are operating with surgeons that are already doing it out there, right? Like you guys are finding them through like your medical school and training process, correct? In Ghana, let me see. In Ghana, we do have a training program in cardiothoracic surgery, but you have to do general surgery first before you do cardiothoracic surgery. Okay. And how competitive is it? How competitive is cardiothoracic surgery training?
So in Ghana, I actually don't know much about it. Not many people go to.
Yes, we
I
can't
just
get you clearly.
Yeah. Hi.
Yeah, hi. I was saying that in Ghana, it's not very competitive. Not many people go into it. And for the people who do want to go into it, they usually want to go outside. Yeah, but I don't know so much about it. Yeah.
Okay. So what I'm getting is it's not as or it's not competitive to get that. Is that what I heard?
Yeah, yeah.
Okay. All right. So this is that's great. Thank you. And what I think is
But it's
important
not
when you're picking,
crazy.
sorry, want to say something else? I didn't. Okay. Um, what I wanted to go over is for mentorship and selecting a mentor and how that's going to be important. So, the advice that I always give for selecting a mentor in any field is to find somebody, and it doesn't necessarily have to be in your field. And that's what's tricky. Is it has to be somebody that has the lifestyle that you want and holds the same principles and values that you do, and also that will be able to help you and is actually genuinely interested in teaching and helping you, that are within the field of medicine in general. So for example, my mentor, as a cardiothoracic surgeon, my mentor is actually an OBGYN. um and the way that I chose her is we initially became connected through training, but I saw that she is also a mother. She has like three kids, and she has a very full life outside of work, and she's also has a business that pursue where she pursues her own personal interests, and she's able to run that and practice medicine. And she's very happy in general. She's a very happy person. She's very happy in life. And that's what I wanted to be, because I know a lot of cardiothoracic surgeons, not all, but a lot of them that are generally unhappy, or haven't, just have a little bit of a different way of going about life. And that just wasn't gonna because that's not really the kind of life that I wanted to live. That wasn't really going to work for me in mentorship. Um, and so I would say, when you're looking at your mentor, that's the first thing that I would look for within the field of, even if you want to go into cardiothoracic surgery within the field of medicine, and then go from there, because ultimately that's going to be the person, when you're getting to letters of recommendation and connections and everything, that's the person, that the one that you connect with, that's really going to help you the most, not just in your medical journey, but in your life journey. And those are really the relationships that you're looking to make. So as a woman, in cardiothoracic surgery, I honestly, I there were some, and I had great mentors that trained me, that were both male and female. Predominantly, cardiothoracic surgery in the US is still male dominated, and I had a lot of really wonderful male mentors. But the as far as just really connecting with somebody and wanting to model my life after them, um that was a woman for me, and that was an OBGYN for me. Does that help anybody? Does that resonate with anybody? I'm just curious what you guys think about that. Does that surprise anybody? Yeah, I would love to get some insight on CT surgery following general surgery residency in the US. Whenever others are done with their queries, I would love to touch base with you. Okay, great. Yeah, sounds good. And let me see. In Algeria, after graduation, after 7 years of medical school, you need to pass the exam, and then you'll have an average, and it's not competitive because of lack of experience. And the stress in the majority of medical students are women, so they can consider
Um,
a
I
lifestyle.
will say
Yeah.
I would say for us here in Cameroon, the mentorship component is not that rigorous as in the US because at one point student feels like to be tokenized. That is, the students, the relationship between the students and maybe the established physicians, it's kind of rigid where the students always finds it difficult to have a relationship like mentorship relationship. But recently we are trying to build a system where students will be able to aspire to be like some of their teachers in school, and there are really some teachers that are really going extra mile to hold the hands of the younger students and to inspire them in the field that are going. But mentorship is not at robust and it's not like institutionalized at the level of training programs here in Cameroon. So it's something that we still need to work on at the level of residency programs and even going to specialty.
Yeah, that's great. And I think what you guys are doing, also connecting with people on LinkedIn like this, and just getting the perspectives of different people that you may connect with. Like not everyone's going to connect with me or resonate with me as a cardiothoracic surgeon, but I knew that for me, it was almost like I needed to find someone that was doing what I wanted to do in that setting, right? So I have a 5-year-old daughter. Her name is Harper, and she just turned 5 actually. And I did 5 years of yeah, I did the 5 years of general surgery residency, and I did 2 years of cardiothoracic surgery training. I had my daughter in fellowship, and I had, then I've been an attending cardiothoracic surgeon for 5 years. So since that time, it can be training in any specialty can be a very lonely and isolating experience. And particularly, my husband is a general surgeon. So particularly when we had my baby, I was a second year fellow, and we had a brand new baby, and I was looking for jobs at the same time. So I think that I found that to be a very isolating, challenging experience because I was trying to interview for all these jobs while I was also, very like 8 months pregnant. And it was a lot of people didn't really, I think, like the idea of hiring a surgeon that was going to have a newborn baby, right? Um, and so when I became a cardiothoracic surgeon, like an attending surgeon, when I got my job, which I started in about like 6 months after that, right? I decided that I was gonna mentor people that wanted to do it, but it was very hard for me to get out there and make myself known as a mentor for other women. So I recently had a woman come out from Alabama to shadow me for a week, which is Alabama's across the country from where I live, which is in California. But it was just about her coming out. She wants a family too, right? And so it's about her coming out and watching me, operate. But not only that, but just watching how I go about my life and my day to day. And also then, now that I know her, I'll write her a letter and do all of that for her as well. So I think just building those connections became important for me because I realized that because I represent the minority of people in cardiothoracic surgery, because predominantly, even in general surgery, we still have 22% women, right? Orthopedic surgery, it's like 6%. Cardiothoracic surgery, it's about 4 to 5%. I think these days it's 5%, but closer to 5%. And these are US numbers that I'm talking about. But because I represent the minority of surgeons, of cardiothoracic surgeons, I thought that it was my responsibility really to put myself out there as a mentor for people that resonated with me. So, and most of the people that do actually find me on LinkedIn, it's a great platform to connect with people and really get to know them and really see if they can then kind of help you navigate that process in the future. And especially for those of us that aren't as traditional as we may see, because it's actually a psychological fact that once you see someone that's like you doing something, you're way more likely to do it successfully, right? Do any of you guys have questions about that? Let me read some of the things in the chat. Okay. How long did it take for you to become a CT surgeon? So I'm in the US, and it took me about a total of 11 years. So I did 4 years of medical school, 5 years of general surgery training, and then after that, I did 2 years of cardiothoracic surgery. And please, is it possible to dive into the medical field with a bachelor's in biomedical science? Yeah, absolutely, absolutely. So I actually didn't. My major originally was not a science-based major. I took a very long road to decide what I wanted to do. And I ended up switching. I did, actually, I wanted to do, like, I was very involved in theater and things like that before. So that was a very big switch for me to go from that to sciences. And then I ended up getting my master's as well, prior to going to medical school. So yeah, anything is possible. Okay, let me see. In Nigeria, you do cardiothoracic surgery directly after med school. In order to get a full grasp, it's still very rudimentary. You have to spend 48 months outside of the country. So how do you guys get to go? Is there a program in which you enter to go outside of the country? Can you give me a little bit more insight? How do you find those opportunities?
Hi, Dr. Alexandra. My name is Fulusho. Yeah, I'm a recent graduate from a Nigerian medical school. So ideally, can you hear me?
Yeah, I can hear you're kind of resonating in and out, but can you get a little bit clearer?
All right, hi. So I said,
Perfect. Yeah.
immediately after med school, when you enter your surgery training, you spend your first 2 years rotating through the different surgical specialties. And then the next 4 years, you spend it just in cardiothoracic surgery. However, most institutions in Nigeria have just thoracic surgery.
I see.
They do not have a robust cardiac or open heart program. So for example, in my institution in Lagos, what then happens is that you try to apply to, most people go to usually either India or Ghana or South Africa, mostly. Some people go to United Kingdom too. So there are dedicated centers where we have sort of partnerships with, I'm speaking from my institution, where we send our residents, maybe 50-year residents, we go and spend between 12 and 48 months just doing cardiac surgery. And then by the time they come back, they write their board exams, and then they now could become fellows of the Nigerian board of the board governing them, basically. So what we really lack here is cardiac care, all elements of cardiac care, cardiac, congenital, everything.
Wow. Okay. So that's definitely different. That's helpful to know. So it's kind of the resources are different, right? So what are the steps of getting into any surgery residency after training in the US? Okay. So that's a really great question. Let me answer that question. So if you trained, do you mean if you train there in medical school, or do you mean starting from medical school? So if you are from another country, right, or from just entering into medical school, then you would go through the same process. So you would have to take the MCAT like after college to get into medical school. And then after medical school, then you would have to take the USMLEs, and then you would go through the residency pathway. So you would either, depending on what program you want to do. So if you either want to do general surgery residency, then that would be 5 years. But if you're sure you want to do cardiothoracic surgery, then I think the best thing to do would actually be to apply to one of these integrated programs, like an I-6 program, because that would really shorten the amount of time that it would take for you to complete your goal. For me, I didn't know I wanted to be a cardiothoracic surgeon. I thought I wanted to be my first thought was that I wanted to be a family medicine doctor in medical school. And so it wasn't until my third year in medical school that I decided I wanted to to be a surgeon, right? So then I had to switch everything around last minute because I didn't have any research that pertained to surgery, nothing. So it was a little bit challenging for me because I made that decision so late in the training process. And same with general surgery residency. I thought I wanted to be a general surgeon. It wasn't until like my 4th year that I wanted to, pursue cardiothoracic surgery because we didn't have exposure to it until later. And so for me, again, I didn't have any research, nothing that really pertained to that particular specialty. So it was a little bit more challenging. But if you already have a solid idea that this is definitely what you want to do and you definitely want to do cardiothoracic surgery, then you actually can cut some of that time by applying to like an integrated program like the I6. Does that answer your question?
Yes, please. Thank you.
Okay, sure. And it can be through partnership or observerships. Yeah, so like I said, I've had a few people come observe me and shadow me, and that hasn't been a problem on my end. So I'm a surgeon in private practice. I do primarily heart cases. So I would say about 80-20, but closer to 90-10 now. And predominantly most of those cases are open heart. And so I'm not at a teaching hospital. I'm in a practice with 3 partners, and we generally split call and we split, like the office staff and things like that, but we're independent. And so when I have people reach out to me, it's pretty easy for me to have them come. There is a little bit of paperwork I have to fill out on my end with the hospitals, but usually it gets approved and it's not a big deal. But I have had people reach out to me that have been from other countries. And I think the issue comes more with just getting like a visa or a learning, like some kind of like making it over from that standpoint, because once you can actually make it here, then it's pretty easy for us to arrange that, because I have people within the US that come all the time. So I'm always, I'm happy to, like, there's only so many observerships I can do because I have quite a bit of people, but I'm always happy to have someone over for an observership. Let's see, you said not all cardiothoracic surgeons were happy, and that's why you chose an OBGYN as a mentor, because she was happy. Is there a reason why so many are unhappy? So I wouldn't say that so many are unhappy. I think that I should correct myself, because now I actually do know a lot of cardiothoracic surgeons, male and female, that are pretty satisfied with their lives. But in my training journey, I think the people that I was exposed to, they were generally just not, maybe happy is the wrong word, but I think were not satisfied with their life choices. And I think a lot of that comes with their work-life balance being very, very skewed. And a lot of that has to do with the way that cardiothoracic surgeons were trained before, and a very old school model of training. So, and I write about this in my book, The Heart of Fear. And the book is basically a series of interviews where I interviewed different people in medicine, and as well as I'm a skydiver, so I have like a few interviews with skydivers from that perspective. And the book hinges on finding happiness or succeeding in a high risk, high stress specialty. And so when I look at people who have done well and who have succeeded, and a lot of them have like these characteristics of having a positive mindset, right? And that covers, that's across the board. So the mindset is actually the most important. When I talk to these people that have done really well under these very stressful circumstances, environments, male and female, that is the one common thread, and that is having a positive mindset. So I talk about this in a lot of different, I guess, situations. But flip your feelings is one of my personal models that I always use. And flipping your feelings is transforming transforming a negative emotion into a positive emotion. So basically taking any bad situation and asking yourself, like, how does this serve me? So for example, if I have a day planned with my family, right, with my kid, and then I have an aortic dissection come in, and I know I'm going to be there for 8 hours, and I know that it's going to be like a long case, and basically my day is ruined. I never choose to look at it in that way. I always choose to try and figure out, like, okay, what can I do in the meantime? Like, while when I get to the hospital, is there some other work that I can do so that I can have more time with my family later? Like, I never look at it in a way that's negative. So a lot of it is circumstances, and a lot of it is framing the circumstances. And a lot of doing well in high risk fields is going to be flipping your feelings and choosing to see what most people would see as a negative circumstance, a positive one, if that makes sense. And so, and fewer female surgeons. And I think that there are a lot of institutional barriers for female surgeons. I still think that that's true, even in the year 2024. Let me tell you guys a story. So in the US, the ACGME, which governs like basically fellowship in the US, right? And they give you 3 weeks of vacation if you are a fellow, any fellow. So if you take anything over that 3 weeks, then you have to like delay your boards by 1 year, basically, is how it was explained to me. So I was going to have my baby in March 16th was the day she was going to be born. And I planned out exactly 3 weeks out, right? Like I had to be back. So unfortunately, I had some complications from having my baby. Ended up getting a spinal headache, and I ended up with a coccyx fracture. And so it was very, I still came back because I did not want to wait another year. But it was very painful, and it was hard to go back to operating under those circumstances. And I did feel like it was an institutional barrier that hasn't been addressed, right? And so there are still those things. And I think it does lead to fewer female surgeons, honestly, because that's unpleasant. Like, nobody wants to go through that. And then on top of that, I think I was in May, right? My baby was, I think, less than 3 months old. And I had to go do my congenital rotation in another state, in another city, right? So I was still breastfeeding at the time. So I switched to pumping all the milk. And I had to ship the milk back to the state that I was in on dry ice, which was about $400 US dollars, like every single time you ship the milk. So once a week, I would collect all the milk that I pumped and I would ship it. So again, I do feel like there are barriers, like, and there's not a system in place that really addresses these things. And it was navigating that, even though I was done with my cases, and even though I was done with all the other requirements, just dealing with those things in order to be able to finish on time and not have to delay, boards from 1 year. I think that these are the reasons that we still have a fewer amount of cardiothoracic surgeons. But as more of us, I think, step into this role, I think that these things will get worked out. And I'm not sure exactly how, but I think just bringing awareness, having talks like this, like what we're doing now, I think is going to be a huge step, because the first step is going to be sorting through the emotion, right? Like sorting through, like bringing awareness to, it's something that I call mindset coordinates. And mindset coordinates is another technique that I use, and it's figuring out where you are to see where you need to go next. So the first step is figuring out like where we are and that this is a problem, because for many, many years in cardiothoracic surgery, there weren't any women at all. And so we didn't even know that this was a problem, like this issue with the breastfeeding, this issue with if you get sent on another rotation and you have a baby and you're still breastfeeding. Nobody thought about this stuff for many years. But now here we are, and if we want more women in the field, which is good, we know this. There's a lot of statistics that show that more diversity in any field leads to better outcomes. And we know that, if we have matched, so if we have, people treating their specific demographic, the outcomes are also going to be better just by virtue of that diversity being there, right? So it's an improvement in the right direction. But in order to allow this to be a good place for women to thrive, we need to figure out what the problems are, identify them, just observe the problems, and then we can make a path forward, if that makes sense. All right, let's see. Are there any opportunities for Africans to get into observerships? Yes, absolutely, there are. So I think that, like I talked about, I think the biggest thing is going to be getting over there, like getting over to the US. But I think once you're over here, there are plenty of surgeons that will actually be happy to have observers. Is it a good time to ask a question? Yeah, go ahead and ask your question. Go for it.
Hey, Dr. Kharazi. Hope you're having a good day. Am I audible?
I can hear you.
Yes, we can get you.
Yeah, yeah.
Okay, so I'll go ahead and introduce myself first. I'm Tiasha. I recently graduated from medical school, and I am planning to go into residency in the US, specifically general surgery, followed by cardiothoracics. And well, for the next 1 year, I'll be in cardiothoracic research. But I wanted to ask you, since you're on the other end of it right now, what would you look for in someone's personal statement or their resume to choose, like, oh yeah, this is the person I want to interview right now for this position?
Yeah, that's a great question. I'm so glad you asked that. So again, you have to consider when you're asking that question that anyone that's reading your personal statement is going to be reading it from their lens, right? So what I take from your personal statement is going to have almost nothing to do with you and everything to do with me. Okay. So it's going to depend on how I grew up, like the ideals that I hold, the things that are important to me. And so I think that you have to look at your audience, like you have to look at where you're applying. So if you're looking at writing a single personal statement, I think I would aim it towards the kind of program that you want to end up at, right? So and that's because when they read that personal statement, right, it's going to resonate with them, because the truth is that there's not really a good answer, because there's going to be, if you look at any institution and you look at the breakdown, right, and you look at, okay, you're going to have 80% of like a particular demographic, right? And so they're going to be looking for certain things. I mean, I can tell you the generic answer. I can tell you that, okay, they're going to be looking for someone that's well-rounded, right? We're going to be looking for someone that has had research. It sounds like you have an impressive resume already. So all of that, those are generic things are going to be there. But ultimately, when I'm reading these things, when people write me letters and they want to come for an observership, and I'm looking at, what I want, I'm looking at, is this person like a person that truly is passionate for what they're doing? Like what's their why, right? Like what's their why? Like what are their ideals? Are they just doing this because it has like still a certain like job security? Is that like I sense that sometimes that people want to do this because for that reason. And I think it's a bad reason, right? And I have my own bias why I think that's a bad reason. I don't think that there's any such a thing as job security. I think that has to do with arrival fallacy. And arrival fallacy is this mistaken belief that once you've arrived somewhere, that everything will be going well. And when I get a sense that someone is kind of looking for stability or job security, I always think to myself, like, that it's going to prevent them from overcoming challenges. So I would look for someone that, you know, overcomes challenges and is still enthusiastic and happy and has a very strong sense of why they want to do this and actually looks forward to overcoming those challenges. So that's what I look for. But again, that has everything to do with me. You know what I mean? And so it's gonna really depend on who you're aiming for. Does that make sense?
Oh yeah.
And don't forget, you're choosing them as much as they're choosing you. So, you know what I mean? So, you know, you don't want to end up I'll tell you something. I actually got ghosted, believe it or not, when I think I was 8 months pregnant and I was applying for jobs and I was supposed to fly out to this one practice and interview with them. And I told them I didn't know exactly how to navigate showing up and being 8 months pregnant, right? And so I, you know, asked my program director, who was also, you know, kind of this, like, he didn't know, right? And so he just said, well, once they invite you, tell them. So that's what I did. I said, okay, like I was about to fly out like 3 days. And then I said, well, hey, by the way, when I get there, I'm going to be, you know, 8 months pregnant, by the way. And then they basically like ghosted me. And then they said like, oh, we're not offering the position anymore.
Wow.
I haven't had to do with that. But let me tell
so sorry
you,
you had to go through that. That's terrible.
know something? It was a blessing in disguise. And I'll tell you why. Because say that hadn't happened and maybe they would have put on a show, right? They would have put on a show, I would have gotten, or maybe I would have accepted that job. Do you think that's the kind of job I would ultimately have thrived in? No, right? So you know what? Like if they read your personal statement and they don't like it, maybe like you probably wouldn't thrive there anyway. You know what I mean? So you're choosing them too. Yeah.
Thanks for the answer. I would love to stay connected if you're on Instagram or something.
I am. I'm Alexandra Kharazi, MD on Instagram, and I love connecting with people. So yeah, absolutely.
Right. Thank you so much.
Of course, no problem. Good luck. All right, let's see. I'm gonna answer some more of these questions. These are great questions, guys. I love these. I definitely relate with the statements. The mindset. Yep, absolutely. Women in thoracic surgery have summer observerships only for Americans. How can we navigate that? That's a great question. You know, I'm actually part of the Women in Thoracic Surgery. Let me see if I can you connect with me on LinkedIn and then ask me that and I'll get back to you through like a thread there, because I think that's a really great question. And so can I ask you guys, when you are looking to get into the US, what's the process? Do you have to get a visa? Does anybody know? Like, what's the process?
I'll answer that. So we would have to go through the USMLEs, like the other medical graduates. But on top of that, we go through something called ECFMG, Education Commission of Foreign Medical Graduates. They provide us a certification. We sit for the match, and then they give us a J1 visa or an H1 visa in the process.
Okay. So how long does that take?
So the J1 depends. The J1 takes about, depending on the country, depends like 2 to 3 months. And you would be getting that J1 for 7 years at least, unless you're extending.
Okay. And would you say it's easy, hard? Like, what do you think is the, like, how hard is it to get a J1?
For me, I'm right now currently in the process of getting a J1 for my research. And it is a lot of paperwork, but I do know that J1 is easier to get as compared to an H1 because they're more widely available. But they do come with the risk that you have to either serve in an underserved area for 3 years after completion of your residency program or go back to your country for 2 years.
Got it. Okay. Well, that's helpful. So I think because I wonder how much of it is that, how much of it is the visa process, right? And streamlining, you know, because I know I had a student from Mexico come and it was challenging for her, but it was a little bit, I want to say a little easier, but she came for a little while from Mexico. and how to get research opportunities from overseas. That's a good question as well. That I'm not sure because I don't do any academic work, but I can probably find out for you and get back to you because I don't know the answer for research off the top of my head since I'm mostly clinical. All right. Do you guys have any other questions? I know I wanted to touch on mainly those things, but do you guys have any questions about the training in general? Yeah. Mm-hmm.
Hi, Dr. Alexandra. Yeah, I wanted to just add something to what Tiasha said earlier concerning the visa process. So I think most of what she said touched on people, and Tiasha, you can correct me if I'm wrong, on people who have already taken the at least 2 USMLE steps, step 1 and step 2 CK, and are already being verified or certified by ECFMG. However, for a couple of us who haven't completed that process yet, personally speaking, I'm just about to take my step 1, and after taking my step 1, I plan on applying for a research fellowship or come for observerships. Now, therein goes the problem. For observerships especially, for example, if I want to come for an observership with you, getting a visa is usually very tough. My school my medical school, when I was in medical school, we had a partnership with Northwestern Medicine, Feinberg School of Medicine, and they usually select 2 students annually to come for an elective. I was one of the 2 students selected at a particular year. I completed the process and I was denied the visa. In cardiac surgery. So that's, for me, that's usually the biggest headache. And we keep on, or I and a couple of my other colleagues keep on trying to navigate the easiest and fastest way of getting into the US to be able to, do as many observerships as possible and hopefully do a research here, like Tiasha rightly said she's about to do. So that's just a comment saying usually that's one of the challenges some of us, go through getting into the US first, even before applying for the match.
Yeah, no, that's definitely tough. And is it as tough with the US or is it if you're trying to apply to like the UK, or is it just as tough or is it just the US?
I think for US it is much tougher because we all know it's the US dream. So exactly. A lot of us who come from high population countries, like I had to apply for my B1 visa when I was coming over for electives. And the first date I got was 560 days after. And so I had to redo the entire visa process, and I had to say that this is my date, I needed an emergency visa, and it got done. But yeah, it does come with a lot of vices.
So what Tiasha just said was exactly the same thing that happened to me. I applied for an emergency and still got denied. So it was a very tough process. So yeah.
Yeah, no, that is tough, but I'm wondering also if there's like a workaround, like if, like going through the UK or Australia or other places that do have a lot of very similar training programs to the programs in the US, if that might be a workaround, because it might be easier to get like a spot there, and then you could, from once you're there, coming to the US might be easier. I'm just trying to think in my head if that might be a like another thing to consider, because they have a very, very similar training process to the training process in the US.
Well, I would say from experience of some of my seniors, actually it's you have to go to your own process. For example, in the UK, you have to take the PLAB 1 and PLAB 2. And after succeeding, you have to apply to be a junior doctor. But still, if you want to go to the US, you still have to go through the USMLE and the ECFMG process before you are being taken into a program to the US. So it all revolves still around the USMLE, no matter where you are from or where you are going to. As an IMG, you have to go through the ECFMG process, and the visa process, that's the major hurdle and the major struggle especially for African medics and early physicians.
I see. I see. Yeah, that makes sense. Yeah, no, thanks for letting me know because I didn't know how that worked. Great. Let me see. I think that there's another question. Is cardiothoracic surgery very competitive in the US? Do you need clinical experiences and lots of research? So, yeah, yes and no. I think a lot of it has to do with, so in my process, I think I mentioned this, but I'm one of those people that I don't know exactly what I want to do until I experience it. So I wanted to go to medical school because I wanted to be a family medicine doctor. Like I wanted to treat everybody with all sorts of ailments, and I wanted to treat little kids and geriatric patients. And then when I actually did that in the US, I realized that there's not, at least where I wanted to practice, there weren't a lot of opportunities to do procedures. And there was a lot of just the practice pattern was not what I wanted. And I wanted to be very active and procedural. And that's why I chose general surgery. But because of that, I didn't have time to really prep my resume, right? And so what did I do? I just made sure that once I wanted to do that, I had very good letters of recommendation from the people on my surgery rotation when I was in medical school. And I just wrote some case reports, but I hadn't had time to get involved in research up until that point. And I did do very well on USMLE. So one caveat is that I'm a good test taker. But that's probably the easiest part of it, I'll be honest with you, because if you can be a good test taker, I think that will objective, and it's all the same formula. So if you can just figure out, like, just do the questions, and I don't know exactly what it is now. We did the UWorld, and I just did all the UWorld questions. I did pretty well on USMLE. Back then, step 1 score was very important. I think now it might be step 2. I'm not sure. But back then, USMLE step 1 mattered, and I did very well on that. And then I was able to kind of relax a little bit for step 2. Because, at that point, I think I was already on my way to matching. And then I matched into general surgery, and a lot of here it matters that I just matched. I was very open about where to match. I ranked a lot of places, and I said, it doesn't really matter. Like I was very open to every program, and I knew that I could pretty much make it work and make it what I needed it to be. And once I got to general surgery residency, the same thing happened. I wanted to be a general surgeon. And then I realized that, I in my 4th year, I became interested in thoracic surgery, which I ended up doing cardiac after all of that. But anyway, that's what led me to apply to cardiothoracic fellowship. And once again, I didn't really have a whole lot of research experience at that point. So I just did as much as I could. I followed or I did like a elective rotation with cardiothoracic surgeons. I got letters. I did case reports. Even with a pediatric, you have to think outside the box a little bit, right? So I found like a pediatric surgeon that did, VATS procedures and thoracic duct ligations. And, we published together, and we, put that counted as a cardiothoracic kind of research. And I did a poster. You have to kind of find ways to kind of beef up your resume a little bit. And some of it is maybe getting a little creative, but I didn't have much time. And then, so yeah, it would have been better if I had all those things, honestly, but I didn't. And you have to kind of just make it work, from that standpoint. So what I'm trying to get at is, it is competitive, but even if you don't have all those things, then don't give up hope. Because I'm probably that example of that person because I didn't have all those things. So you're probably fine. Let's see. And does the age of the applicant count? Yes and no. I know that sometimes it works for you. Like my husband is a general surgeon, but because he was a general surgeon, he was an engineer. So he's older. He's like almost 10 years older than I am. And he was an older applicant into general surgery. And that actually, having had job experience, actually worked in his favor. So sometimes it works for you. Sometimes it just, again, it depends on what that program is looking for that you're applying to. Who had good averages? Let's see. UWorld. Step 1 is pass fail? No way. Oh my goodness. Oh, and 0 IMG matched into CTS last year. Huh, I didn't know that. That's interesting.
Hi,
Okay.
Dr. Alexandra. I've got another question. This is for the
Yeah.
show. Yeah, okay. So I would like to ask about IMGs who get into preliminary training, what the hope for them usually is. Because I have a senior colleague who, and especially if there are quote unquote toxic programs, because there are a lot of things we see on Reddit about very toxic surgery residency programs in different institutions. But aside that, if you apply, for the match, the regular match, and then you're not able to get a categorical spot, and you end up getting a prelim spot for general surgery, is your advice to take that spot, bearing in mind that you are a leg in and a leg out, probably more of a leg out, because if you do your prelim year 1 and you have to reapply for the match again to get into a categorical spot, you are always racing. I don't know if you get what I'm saying. It's usually a very tough for IMGs. I'm talking about for IMGs now because I've had about 1 or 2 senior colleagues who have done that and have to do a prelim year 2. And then after prelim year 2, if you don't get an institution that wouldn't take you directly into CAT year 2 or CAT year 3, you are almost done for. So what's usually your advice? Would you say get into the prelim program or wait and apply again for another year? Hi, can anybody hear me? Can't hear anything. Hello?
Yes, we can get you.
Oh,
It seems
I
like
think
Dr. Alexandra got offline, so let's just wait a little. I think she's not get the whole of your question.
We got, hello? Hi, I think we got disconnected.
yeah.
Hello?
Hi, Dr.
Yeah,
Alexandra.
exactly. But we can
We
get
got
you now.
disconnected. Okay, to answer your
Most of my
question, yeah, no, that was a great question. I wanted to answer it, but yes, I would recommend matching into the prelim spot. And I've talked about this with my friends as well across the country, because in my residency program, as well as where my other colleagues, we've seen the prelims, including my friend Dante, who is from Africa, who I'd like to connect you guys with. He's a cardiothoracic surgeon here in the US, and he came from Africa as well. So he would be very helpful, and he wants to talk to you guys too. But we've noticed that if you get a prelim spot, there's a high percentage of people that are then making it to categorical spots. So I would recommend taking it.
All right, thank
Can you guys hear me?
Yeah, I heard you. I have just one other question. I'm good.
Sure.
So Also for general surgery. So for those of us or for people who probably are, looking at the time taken for the entire training, as for general surgery and then a CT fellowship, or having a direct integrated, but integrated for IMGs is almost next to impossible. Not next to impossible, but always very, very rare to see. I personally don't know anyone that has been able to match into integrated. So it's usually the traditional route. However, over the years, what I always saw was 5 years of general surgery and then 2 to 3 years of cardiothoracic surgery. But now it's about 7 years of general surgery. Is it a fact that most institutions are mandating a 2-year research year among their general surgery residents? Because I know 5 years clinical surgery and then 2 years research year, making it 7. Is that something common now? Or issues?
Yeah, so I finished training 5 years ago. It was not common at that time. No, but I know that there's these like 4-3 programs, and some of those programs you do have some research year. It's not mandated, but it's recommended, and in some of the programs, up front, it's built into that structure. So yes. Yes and no, it really depends, but it's not mandated. Should one look for general surgery residency or research year for integrated cardiac, that's an interesting question. I would do general surgery residency. So are you asking if you have to choose between the two, between general surgery residency and research, or I just want to make sure I understand your question. Okay, I would go for the general surgery residency over the research year, unless you're really, really passionate about that specific research that you're doing. If there's any other questions, because I did want to share with you guys, I put in the chat the name of my friend that's a cardiothoracic surgeon who came from Africa, and his name is Dante. I put his name in the chat. He's on LinkedIn, and that's probably the best way to connect with him. And I told him I was going to talk to you guys, and he was very interested in speaking with you guys too. And I think he could help navigate some of the visa issues, because he actually went through and getting over to get an observership. So I think that would be a really great connection, because he obviously did it himself. So that would be a great connection, a great person to talk to. And he's a really good guy. Can one do a general surgery residency in their home country and apply for a cardiac surgery fellowship in the US? I think so. So my dad actually, he did something, he's in medicine, but he did something similar. So he did all of his training in the Ukraine, came over here, and what he had to do is he had to repeat all of his testing. So he had to do the USMLEs, all of that again, before like a fellowship training out here. So there is that. I'm presuming it's something similar, but you have to retake all of your testing again. And that's just based on my personal experience of, knowing what my dad had to go through. So perfect. Wonderful. Thank you, Tiasha. All right. Do you guys have any other questions for me that I can help with? And by the way, if I know some of you guys have already messaged me independently on LinkedIn, message me. It might take me a little while to respond, but I am as soon as I can, or if not, then I can always direct you over to Dante to help out as well. So if I don't have the answer for you, I can probably get it straight away. Okay. Okay. Do you guys have any other questions? How to apply for your observership? So just message me. Just message me. Just give me a little bit about like just a little info. It's informal. It's informal. So yeah. I had a oh, here we go. Hold on. I've got another question here. Oh, yeah, sure, no problem. The easiest way to connect with me is on LinkedIn. I also have Instagram, but LinkedIn's probably the easiest. And it's just my name. So, and then I'll give you guys my Instagram. And I do have a TikTok platform as well. And I'll give you guys that. And that is mainly, yeah. So my TikTok platform is a lot of like tips and like mindset stuff. Like as I told you guys, I wrote a book called The Heart of Fear, and a lot of it had to do with mindset and how to navigate a high stress, high risk specialty and the mindset surrounding that. So on my platform, I do have some tips about mindset hacks that I use that might help you guys out if you're interested in that sort of thing. Let's see, as doing CT surgery in your home country considered clinical experience and it may boost your chances. Yeah, absolutely. That's considered clinical experience. Yeah, absolutely. Yes, that's a great question. Okay, cool. All right, if you guys don't have any other, I'm waiting another 30 seconds here, but if you guys don't have any other questions, then I think we can wrap up. What do you guys think?
I don't have any questions. I just wanted to say thank you so much for this session. It is so uncommon for me to see another woman in the field, and I've been searching for one for so long. It is such a relief to have a mentor.
Oh, absolutely. And you know what? That's why I do this. This is my why. I don't know if you could tell that, but I really love connecting with other women. And I always said that once I got to this position, I would connect with other people. So when any medical students or anything, when you guys reached out to me to do this talk, I was just thrilled to do it. Because I really, really do enjoy, talking to you guys. So and yeah, I am happy to do it. And let's see, I saw another question come through. Okay. Yep, that's it. Yep. And LinkedIn is just my name and my last name. I'll just type that in for you guys. Okay. All right. So please reach out to me on any platform. I'll give you guys my website too. That one's a little bit more just articles and stuff like that. I did a talk on an app called 5 Minutes for Me, also about mindset. So you can grab that on there if you're interested.
Thank you very much, Dr. Alexander, for this amazing session. And it was really insightful. And thank you for everyone being present. So before we conclude, I will call on everyone, if you can switch on your camera, let's take a quick family picture.
Please, I want to be there.
So if you can switch on your camera, let's take a quick family picture. That would be great. So we'll take picture in 30 seconds. Okay. Are you guys all set?
You guys see me? Okay, my camera's still on. Okay, good.
Yes, we can see you.
It's nice to see all of you guys. Hi.
Wait.
Oh, it's nice to see all of you guys. That's so awesome. I love this. You guys look so young. I didn't realize how young. Wow, I feel so much older when I'm looking at you guys. You're so young. Ken Fack, you look very young. You look like super young.
It's very flattering.
Okay. Are we ready? We are going to take the picture now.
Okay.
Okay, let's give our brother a smile.
All right.
Okay, let's go out for another one. Okay. Okay, thank you very much. It's all safe.
Okay. Thank you very much, Dr. Alexandra.
Thank you guys. Thank you guys. Thank you for hanging out with me this morning. It was truly a pleasure and an honor to talk to you guys. So thank you.
Yeah, it's amazing.
It was such a great session.
Thanks, guys. All right. I look forward to keeping